There really has to be very good communications between the various teams looking after the patients, such as the GPs in primary care, physiotherapy, microbiology, surgery, and any other community services that the patient may need.
The support of the family has been brilliant. I mean, let's face it, being in hospital for 5 months isn't easy for anybody, but you do need help. As long as we got him back home, that was all that mattered.
Some patients will be discharged home with additional intravenous antibiotics and some with oral antibiotics. And antibiotics can often have side effects and patients can be intolerant to those. So they need to be prepared for this.
It's important not to make any changes to that antibiotic regimen without speaking to the orthopaedic team. These are drawn-out course of antibiotics, need a lot of consideration and just a bit of support for the person that actually, I'm really sorry that you're not feeling well. We can take some advice on that, but you don't feel well and hopefully we can get you better, giving them some hope.
And you were here?
Yeah, I was here. That's why I got no door frames, because I couldn't get the wheelchair through.
Physios do form very strong, solid relationships with patients because oftentimes when patients come to see us, they're really, really struggling.
To have intensive physio was absolutely brilliant.
We talk with patients around safe positions, we talk with patients around specific wound care, things that we wouldn't ordinarily talk with primary joint replacements. As far as exercises go, a lot of the exercises are fairly similar, but following an infection, we just start them a little slower.
Well, you've got to be very careful, and it is painful for several weeks. Got to persevere with any exercises you're asked to do, and eventually it improves and you get back to normal.
I used to go out walking every single day because if you don't, it becomes very stiff, and then when you move it's really, really painful. When I first come out of hospital, I used to set myself targets, so I'd go out and I'd walk at the road so far. So I walk out to the garages and then back. You know, a week later I'd walk out to the bollards and then back. And I continuously do that until eventually I could walk around the block.
Be that hoists, be that hospital beds, whatever it is, the occupational therapists are the expert in that equipment provision and assessment of complex specialised equipment.
How am I doing now? This year I had another hip replacement and I'm absolutely fine. It's all good. As you can see, I've got no walking aids, no nothing. I'm back at work, and I'm pleased. This touch wood, this time it's all been good. Not a problem.